All right, Miss Jasmine, take it away.
Hi, today we're going to be speaking about oral health awareness. This is going to be a webinar that we're having for the month of April, April 23rd, 2026, and it's from 1 to 2. It's going to be providing education, as well as my name is Jasmine Alexander. I'm the oral health program manager. Can you just go to slide 2, please? We're going to provide here, you could please read the disclaimer that we have on the screen.
And I'll read that disclaimer, Ms. Jasmine. The Louisiana Department of Health, employees, contractors, affiliates, et al. Have no actual or potential conflict of interest in relation to this program presentation. The content herein is intended for general guidance, not as legal advice. Laws and regulations take priority if there are any differences. Only LDH's Secretary or Surgeon General can give official statements. LDH cannot speak for other government agencies, and if you need legal advice, you should consult a lawyer.
Next slide, please. So the objective of today's webinar is to drive collaboration throughout the state that connects communities to tools and resources that can improve health of our residents where they live, work, learn, play, and pray. Next slide. I would like to open the remarks to Dr. Nancy Lothal, our Bureau Director, Wellhead, Louisiana Bureau of Chronic Disease Prevention and Healthcare Access within the Office of Public Health at Louisiana Department of Health.
Well, thank you so much, and good afternoon, everyone. It is a pleasure to be here with you. Oral health is a critical component of well-being. At the Louisiana Department of Health, we approach oral health through multiple programs, including preventing tooth decay, through our program to reach school-aged children with preventive oral health services. We also ensure municipal water systems that have fluoridation are functioning properly, and we ensure pregnant women, infants, and children covered through the Louisiana Child Health Insurance Program have access to oral health services, among other services that are provided by the Louisiana Department of Health. As the mouth is a gateway to the body, serving as a primary entry point for bacteria, nutrients, and air into our digestive and respiratory systems, oral health is more than ensuring the psychological benefits of a beautiful smile. Oral health is about the physiological benefits over the life course, such as preventing poor birth outcomes, diabetes, heart disease, and even Alzheimer's and dementia. At Wellhead, our vision is to reduce the burden of chronic disease and assure access to quality health care for all Louisiana residents. We work alongside leaders at key organizations across the state, such as child care centers, colleges, universities, faith-based organizations, restaurants, school, work sites, and healthcare facilities, helping to create environments in which everyone can be healthy. We believe that everyone has a role to play in connecting Louisiana communities to healthier futures. We are committed to educating and empowering leaders across the state with actionable steps to improve Louisiana's health. Again, we welcome you to today's webinar, and I'd like to turn it back over to you, Jasmine.
Thank you, Dr. Lothal, for that message. Can we move to the next slide, please? I would like to introduce our speaker for today. Is Dr. Sterling Roberts. Dr. Sterling Roberts is a native of New Orleans, Louisiana. She received a Bachelor's of Science in Neuroscience and Behavior Biology in 2009 from Emory University. In 2025, she earned her dental degree from Howard University College of Dentistry. Following dental school, she completed her postdoctoral study in New York at New York University in June of 2017, specializing in pediatric dentistry. Her training has provided her extensive experiences in all aspects of pediatric dentistry, encompassing care for children of all ages and patients with special needs. She is a member of Delta Sigma Theta Sorority Incorporated, fellow of the Pierre Fauchard Academy and the American College of Dentists. American Academy of Pediatric Dentistry, and a diplomat. American Board of Pediatric Dentistry, American Board of Pediatric Dentistry College of Diplomats, where she will be serving as a trustee of the Southwestern District. In 2021, she began her career in academia as part-time faculty member at LSU School of Dentistry in Pediatric Department. In June of 2023, she furthered her passion in academics by serving as a full-time faculty in the role of Director of Advanced Education in the Pediatric Dentistry Department. An avid traveler, this self-proclaimed foodie loves to eat, enjoys attending as many Saints games as possible, festing and spending time with family. Dr. Roberts' passion for serving the underserved has brought her back home to Louisiana, where she is excited to continue to give back in the form of dental education and services to her community. Dr. Roberts, we are very happy to have you here today. Could you please share anything right quick with us before you begin your slides? I'm sorry, Dr. Roberts, you're currently on mute.
There we go. I am thrilled to be able to present just something that I am passionate about, and we have had a complete oral health day. I was with Jasmine this morning, Ms. Alexander, with delivering the exact focus of the Well Ahead Oral Health initiative. So it was great to, be able to bond with you all and see where this goes regarding taking care of the children in our community. So thank you.
You're welcome. So would we love to start sharing slides, Dr. Roberts?
Okay, so let's see. You're all able to see the screen, I'm assuming. Everything looks good on your end?
Yes, Dr. Roberts. I still see the speaker screen. We wanted to make sure that you were sharing your slides. Yes, it looks great. We can see it.
Okay, so you are able to see the screen that has the PowerPoint.
Yes, ma'am.
Okay, great. I have to ask because, sorry all, but I am probably one of the most non-tech savvy millennials. I'm not doing
Oh, I'm in that department with
one of
you.
those. So I'll get started. Good afternoon, and again, thank you all for the opportunity to speak with you today. As Ms. Alexander stated, my name is Dr. Sterling Roberts. I am currently serving as the Program Director of Advanced Education and Pediatric Dentistry at LSU Health Science Center School of Dentistry. Today, my big focus is on how we, as providers, can better integrate pediatric oral health into comprehensive health care here in Louisiana. And particularly, that would be through prevention, because early intervention and stronger medical dental collaboration is what would be needed for us to make great breakthroughs. So I'd like us to keep in mind that although oral disease is often treated or thought of as separate from overall health, the evidence in our daily clinical exposure and experiences tell us the exact opposite. Right, so oral health is a population health issue. It's an access issue and it's a systems issue that should be taken a bit more seriously when we are discussing overall health for all populations. So I have no actual or potential conflict of interest in relation to this presentation. So here are our objectives. By the end of this presentation, I want us to do about 6 things, right? And those 6 things would be to, 1, understand the scope of what pediatric oral disease looks like in Louisiana, being able to appreciate how oral health affects overall health along with quality of life, identify major risk factors for early childhood caries. We're going to do a review, very brief, but a review of practical and preventative strategies defining the role of medical providers in early prevention, along with being able to refer appropriately, and identifying opportunities to improve the coordination across our systems here in Louisiana, our healthcare systems. So you can also think of this presentation in three broader buckets, right? Those buckets would be the burden of disease, the opportunity for prevention, and the need for coordinated implementation. So the problem here in Louisiana, this is where I begin in frames of urgency, right? So in the materials built from this lecture, it is that approximately 65.7% of children right here in Louisiana had experienced dental decay. And that's compared roughly with 52% nationally. So even if we set aside the exact year of the figure here, right, that message still remains unchanged, whether it's from 2022, 23, or even the early to late 90s. And what the message is that pediatric oral disease remains common, it's preventable, and it's unequally distributed. I also would like us to keep in mind when it comes to diseases in children, especially children under the age of 12, is that dental disease, dental decay, is the most prevalent disease affecting children. And it's important that we remember and think of dental decay as a disease because that's exactly what it is, not just simply holes in teeth. And so the newer CDC national surveillance data reinforces this concern. So the CDC's 2024 oral health surveillance report, it found that about half of children between the ages of 6 to 9 have had cavities. So that's nearly 17% that had untreated dental decay. And the burden is much worse when it comes to children who live in areas of poverty. Those children happen to have untreated decay between the ages of 6 to 9 of 26.3%. And that's particularly in the high poverty groups versus 10% in those children that live in lower poverty groups. So that's not just a dental disparity. Think of it more or less as a public health disparity. So when I speak about drivers, I want to reinforce and rather emphasize that dental decay is multifactorial. It is going to be part of what I'm wanting us to relate is that limited access to care, low oral health literacy, high sugar exposures, inconsistent fluoride exposures are all contributing to this. So I would just say that we need to make sure that we are recognizing these modifiable systems and behaviors rather than trying to place blame on one particular thing. And one practical takeaway is that children carrying the highest burden are often the same children that are already interacting with our Medicaid systems, primary care, school-based services, and our community programs. So this is, again, exactly why we cannot allow oral health to just sit in a silo on its own. So taking a look at the picture you see on the right, it happens to be taken one of my photos from a child that I've seen in clinic. Surprisingly, but maybe to most, but not surprising to us here in the pediatric dental world, is that unfortunately this is a very, very common situation. Seeing that this child, if we're looking, has what we call anterior dental decay on the teeth that are located directly in the front of their mouth. These teeth are the ones that erupt first in a child. So if you can see like where it's yellow and broken down, those are the first teeth in an infant's mouth. And so untreated oral disease is going to affect more than just the teeth. It's affecting, when not treated, it's going to affect their eating, their sleep, their behavior, school readiness, and school attendance. And also it provides an additional stress for caregivers who are already undergoing probably unsurmountable stressors outside of their own children. In my original talk, which was so long, and I could go on a TED talk about it, I wanted to, or I emphasized the importance of pain and infection. Dental decay also will affect a child's self-esteem. which means it's going to affect their social functioning. So those points, of course, they still matter. And it's worth stating because it's going to translate the clinical disease that we see into real life function. So I'd like to put it that the experience of a cavity is not simply a statistics, but when we're experiencing pain, right, again, affecting eating, difficulty sleeping, children become very irritable, they miss school, which is already an issue for some when it comes to access. Also, in that delayed care is going to allow for things to become more invasive when we as the practitioners are treating, along with adding an additional expense. The CDC notes that oral disease carries broad consequences beyond the mouth. Oral health is part of this quality of life, right? The daily function, the poor oral health, again, is going to affect the parent's ability and rather the whole family's ability to attend work in other schools if you have more than one child, right? Or working with a single family, or rather a single parent home, or parents that are both very much so in the work field. So again, this is why the prevention is going to be part of our comprehensive well health. So key takeaway from here is that oral disease affects the function, not simply just long-term health. So here in this photo, if you see the child's face that is on your upper, it would be your upper right, you would notice that there's facial swelling that's here. The facial swelling is located on the lower left of the child. So your left would be the patient's, your left, your right is actually the patient's left. And I drew an arrow to show you what we are able to see in our emergency room. Looking at the arrow for the picture, you'll see a what we call grossly decayed tooth, right? So that's a tooth that has dental infection that has gone untreated. That untreated decay has resulted in massive infection, right? And that infection, especially where it's located in this child's mouth, as you see, it's in the lower left jaw. When untreated, that swelling can lead to a sepsis and a transfer of bacteria that can ultimately end up in lymph nodes and lip spaces that can result in inabilities to breathe. And ultimately, if we leave these things further untreated, can result in death. So here in this slide, what happened after this child did report to our emergency clinic at Ochsner is that the child did have to be sedated for the emergency extraction of the two teeth that you see on the bottom. Another quick caveat or point to note out is that these teeth have full roots on them, meaning that this child who is under the age of 6 ended up losing their teeth well before they were due. The full roots explain or rather reveal that this child, if these teeth were, let's say, restored or filled quite earlier, would have had a longevity until the child was about 12 years old, but unfortunately they had to be removed because of the state of infection. So with all of that being said, right, untreated dental disease drives emergency utilization. That emergency utilization, to reinforce, keep pushing it, is that it's miss school, miss work, and then a downstream of restorative costs. The newest CDC data point shows that there are about 34 million school hours and 92 million work hours that are lost every single year for unplanned emergencies related directly to dental care. And roughly, if we're thinking about big numbers in the US that we do not have to waste, it comes out to about $46 billion in productivity lost annually due simply to untreated oral disease. And if you want any additional information, right, the CDC also reported in 2017 that there were 2.1 million emergency dental visits in the emergency alone. And of those, Medicaid paid for about 69% of all those visits for children. So that makes the case that delayed care becomes expensive for the public sector of care. So we're either paying very little through early prevention, right? Or we end up paying quite a bit more if we're waiting for pain emergency care and those missed school, missed productivity margins. So what is the solution, right? Solution is prevention. This is my good news slide, what we can do. Dental caries, again, is one of the most common chronic diseases of childhood, but it also, again, is highly preventable. So the highest yield strategies still remain to be the fluoride exposure, caregiver education, dietary counseling, and the establishment of a dental home. So the current guideline language shows us that the USPSTF gives a grade B recommendation for primary care clinicians to apply fluoride varnish. So what that means is that pediatric dentists are not the only ones that are able to put some effort into oral health, right? So my counterparts in physician medicine can assist by applying fluoride varnish to primary teeth of all infants and children beginning at the primary tooth eruption age. Um, this system also recommends prescribing oral fluoride supplements for children that are in areas where the water fluoride supply is fluoride deficient. And that would begin around age 6 months. So I would encourage us practitioners, when possible, just to triple check, double check what is the fluoridated water system levels. That is very easily accessible through the CDC website. It goes through where every single parish's fluoridation levels are, and you're able to determine or learn whether or not your patient or the child that you're seeing is receiving optimal fluoride based upon their city, their parish's water levels. The AAPD's updated guidance also supports professionally applied fluoride varnish for children at risk. And in its 2024 early childhood caries policy, meaning that it was just recently updated, identifies that 5% sodium fluoride varnish, which is the varnish that looks like a paste, was recommended as the most applicable professional topical fluoride for children that are younger than 6 years old and at risk for early childhood caries. So those who are practitioners, whether you're a PA, a medical physician, or whether you're a nurse practitioner in your office, this means that every well visit is an opportunity to do something brief, but something at high impact. So look in the mouth, assess the risk, and then counsel the caregivers where it's indicated and go ahead and apply that varnish. For infants and toddlers, begin that oral hygiene instructions and talks before the first tooth erupts, right? We want to encourage parents that even before they see teeth, they should be wiping the gums. They can use these little toothettes. You can get them off Amazon. You can get them from Walmart. Or even if parents aren't able to afford that, if you have just a wet towel, that works as well. A terry cloth towel is just fine. We want to wipe again the gums, wipe where the teeth will erupt. And then once the teeth erupt, we're going to reinforce the brushing daily with a fluoridated toothpaste. That'll be about the size of a smear or a piece of rice. With all that's going on with the fluoride debates, it is still recommended that we use toothpaste that have a fluoride in them. And if parents are skeptical or concerned, remind them that this fluoride is not to be ingested. And the rice size, the very, very tiny amount that we are recommending, is more than enough to coat the teeth that they have. But it's also such a tiny amount of fluoride within that toothpaste amount that even if a child, which they will eat the toothpaste, swallows it, it's not going to make them sick when we're using it in supervision. Also, breastfeeding has important health benefits, but more recently, AAPD dietary guidance has noted that breastfeeding beyond 12 months, so if a kid's over 1 year old, particularly if they're getting those nocturnal or frequent feeds, that is also associated with increased caries risk. So guiding our parents about when is the time to cut it off, to wean, give them the real reason why, not to be harsh, but because it can affect their child's oral health. And the American Academy of Pediatric Dentistry, along with the AAP, also advises avoiding adding sugars to children that are under age 2. So that means that juice in infants from 6 to 12 months should be limited, 100% juice, to no more than 4 ounces a day. So a very, very, very small amount. especially in children's ages 1 to 3. We want to encourage parents to completely avoid nighttime bottles, especially if those bottles have milk or juice. Transition to a cup by the first birthday. Let those kids not have something that they're sipping on, because that will just allow for food, milk, and juice to sit on the teeth throughout the day. And then also we want to promote water between meals, and then discourage constant grazing and prolonged sippy cup use. What we really need is for children to have a dental home. So this is probably one of the most important things that we can do, right? We want to keep in mind that a dental home is a well, continuous, comprehensive, family-centered oral health care thing. We want a dental home to be an ongoing relationship. So that means that we would like children, parents, to stick with one place where they're getting all of their care done, as opposed to hopping around, because consistency allows us to not only monitor the children, but also to establish those sound relationships, exactly how the child does with their pediatricians. The current AAP policy states that a child should have a dental home within the first 6 months of eruption of the first tooth, but no later than 1 year of age. So what does this mean is that because early visits create time critical opportunities for risk assessment, caregiver education, and fluoride guidance, it also allows us to do anticipatory guidance, which is where we talk to the parents about things we can do to prevent decay, injury. Some of us don't consider injury as an issue, but if you have ever seen a 1-year-old walking, it is very similar to us walking after a really wonderful night, right? They're not that steady. So we want to make sure that parents understand their risk of injury, because they're not that stable on those feet and with those large heads. And then we also go through why the dental home and the medical home should work in tandem, not simply just in parallel, meaning that we're working together, not in silos alone. This is especially important for our patients with high disease risk. Those would be those with special healthcare needs, our Down syndrome children, the ones with diabetes and other systemic diseases, or inconsistent access altogether. So at age 1, families should look to, or rather expect us to do more than just a quick look. A true infant oral visit includes history, risk assessment, exams, toothbrushing. We do demonstrations, anticipatory guidance, and follow-up plannings. So here you'll see what I was discussing or recommending regarding the toothpaste size. The 0 to 3 years of age, we're going to use the right size amount, and then from 3 plus, meaning a child that's older than 3, a pea size amount. And actually, adults, we should be using that size. A lot of us use way too much toothpaste. But medical providers, to reinforce this, is that they're seeing our children earlier, more often than dental providers, especially within that 0 to 1 year old. So that means that you all in medical offices are not just helpful to prevention, you are the essential part in our prevention plan. Our updated evidence does explicitly support this role, again, recommending that pediatricians, as an entry point, are going to be able to do those important referrals, especially in our populations of risk. And then if a children, again, is under age 3, counseling can be really simple, right? You don't have to go into the details that we do at our offices, but it can be simple, right? Remind the parent to brush twice daily with a smear of fluoride toothpaste. Avoid putting the child to bed with milk or juice, transitioning from that bottle around age 1, keeping the juice limited, and establishing the dental home. And if teething comes up, this is another safe place to offer a little safety pearl, is that the FDA does advise against benzocaine-containing teething products. So that would be something like our Oragel, which we see all the time. Parents will say that they've used it because the child is teething. And then this is because there is a risk of methylglobemia, methylhemoglobinemia, and it's safer for us to recommend for the children to use teething rings that are either chilled or other types of supportive care. Children's Tylenol dose appropriate is also okay within that age. So here we can see that the relation between the number of pediatricians versus the number of pediatric dentists, It's such a big gap, right? So there's one pediatrician per 675 children, right? So quite a bit more access, where when it comes to pediatric dentists, there's only one pediatric per 6,000 children. So we're unable to handle it all. So the question becomes, what works? Like what can Louisiana do that is reliable? And that means that taking advantage of what Medicaid coverage has. So Medicaid does cover some things, but it does not necessarily create the access. So this is why it is so important that we are training medical providers to do oral screenings, and then reinforcing and understanding what those referral pathways are and what they look like. This is going to promote a follow-through system. So if you see a child that is at risk, which most of them are, has dental decay, or you've done a referral, please follow up when that parent returns for those well visits or scheduled shots, or even when they come for their emergency visits. It's so important that we are all doing that follow-up to make sure that things are taking place. So in our coordinated care model, we have a few points that we can all work together, right? So Louisiana already has an infrastructure that's here. We have Medicaid dental coverage for children, which is amazing. It covers pretty much everything. We also have primary care touch points, and then we have our school and community programs, along with mobile care models. So this opportunity is not necessarily to reinvent the wheel, or a brand new system. It just gives us the opportunity to coordinate the things that we already have. So with the three ideas, we have an oral health screening in primary care, stronger referral pathways into dental homes, and then again, those community-based entry points, or outreach sites, such as the mobile dental units, or as we did earlier today, going to the schools and doing some type of school-based program, educating, applying sealants, varnishes, doing oral hygiene education, not even just to the students, but to the educators that are seeing them even more frequently, let's say, than the pediatricians, and sometimes even the caregivers. So children may enter through the medical care system, but again, we have all these areas where we just have to coordinate and work together. So what is the call to action? What we really need on the pediatric dental side is help. This is where we are not going to wait, let's say, for a perfect future to happen, but we're going to work early to prevent those pediatric, or rather to improve our pediatric oral health outcomes. So when it comes to the well child workflow, increase the use of fluoride varnish, use your referral system. So be familiar with your pediatric dentist in the area, and make sure that you all have conversations, right? It doesn't take much time to go to an office and let them know that you're there, or even going to joint meetings that are in your area. And then also, we want to make sure that we are going to be coordinated. So oral education should not, again, just be isolated to dentistry, but in medicine, public health, in schools, families, work, all that prevention is going to make everything much more equitable and sustainable. If your parents are looking for resources, here is where you all can surely do your referral systems to parents. Resources include the AAPD. You can direct them exactly where they can go to get resources about how to find a pediatric dentist, along with, of course, the Well Ahead website is actually really amazing in giving parents information about oral hygiene, sealants, and resources in their area. And for those who are on our state insurances, directing them to where they can find providers is helpful. One other thing to mention when it comes to, and I'll go back a few slides here, is that pediatricians are able to, and even also medical providers are able to bill out for fluoride varnish, right? So if you are unaware or unsure, please take advantage of these reimbursable codes that you can use in your setting. So that way, I mean, of course, we do wonderful things just because we need to do them, but it doesn't hurt if we're able to bill for them as well using the appropriate CPT codes, diagnostic codes, and then also when it comes to us as general dentists as well, using the appropriate Medicaid codes. So with that being said, do you all have any questions?
Yes,
Okay.
we
Hi.
have one question. Why is oral health important for overall health and well-being?
So let's consider where things like start when it comes to the body, right? Everything starts kind of in the mouth. The mouth is where you're getting food, it's where you're getting bacteria. It's also a place where we are able to diagnose things that are going on systemically through the mouth. If we think of our children, let's say, who have diabetes or children with cardiac issues, those kids, oral health is so important when it comes to immunosuppression. So anything that, let's say, would tend to lean towards or could um, result in infection or result in any type of route for bacteria, these children, and not just children, but adults, are at a far greater risk of having systemic infections, meaning that they are at a higher risk for having cardiac arrest, cardiac infections. Also, the kids with diabetes, they're also going to be more susceptible to infections that are going to become more widespread than a child, let's say, that is completely healthy. And in the picture that I showed that had the young child with the abscess, I will go back, this child with the abscess, right? So infection specifically in these submandibular spaces, fancy word for the space underneath where the tongue is, that is directly a pathway, let's say, to the throat, right? So they're unable to breathe. And then that also can go directly to their lungs and their heart. And then right above infections that can happen, let's say in our cavernous sinus areas. So the infections, let's say, that are in the upper arch of the mouth, anything that goes left untreated here, literally the pathway is straight to the brain if it's left untreated, which can also result not just in pain, several hospital visits, but unfortunately death as well.
Thank you so much for that thorough answer. We have another question. Are there local resources in Louisiana for low cost or free dental care?
So I wish we lived in a perfect world. There's no dental care that is free. However, if you're looking to recommend for patients to have more affordable care, our federally qualified health centers are mandated to have sliding fee scales. Those can be located again. If you look up federally qualified health centers here in Louisiana, there is a list of them that is given, so that way parents can pay what they can afford. A lot of those can be like our DePaul centers or centers like X Health, or let's see, there's some other ones that are on the list. Our community, like our Baptist Community Health Center, which we have a tooth bus that's coordinated with them, that is an FQHC as well. And those offer low cost care. But unfortunately, we don't necessarily offer any free dental care anywhere.
Thank you.
However, I would say that if parents are concerned or interested and they are struggling financially, they should perhaps even take advantage of the health screenings, because oftentimes at screenings, you can at least get a no cost, low cost exam. It won't have x-rays, to do complete diagnostics, but at least gives parents a um, outlook on what's going on with their child, along with getting fluoride varnishes or sealants in teeth that are newly erupted and are healthy.
So we have someone, Tori Taylor, that states, where I grew up, rural Maryland, we had a fluoride rinse program based in our elementary school. Is that still a thing, or has it been replaced by the sealing programs? And if so, is that because sealants is more effective?
So I cannot state to a fluoride rinse program in Louisiana. Maybe Ms. Alexander can, because I did not um, grow up with a fluoride rinse program here. I think you probably would be better able to answer that part, but I would like to just note that applying fluoride varnish and doing sealants are two separate action items that have they're parallel, but they're not exactly the same, right? So a sealant is going to protect a tooth from getting decay or preventing food from impacting or getting stuck, let's say, in the grooves of an adult tooth, where fluoride varnish is more of like a topical paste. It's in your toothpaste, but it goes on the outside of the teeth when it's applied, like through a toothbrush or by a dentist, to prevent everyday eating, drinking from breaking down the teeth, and allows the tooth itself to remineralize, or rather heal itself better. Sealants, there are some sealants that have fluoride in them, but their modes of action are a bit different.
Thank you so much. In reference to that, to my knowledge, I do not know of Louisiana having a rinse program previously, but that'd be something that we can look into to see if that was something that they had history of a rinse program. But currently, the school sealing and fluoride varnishing, Smiles for Life, that is on our website. You could go and look to gather more thorough information in regards to the initiatives. We have another question. How can parents help protect their children's teeth from an early age?
First thing would be what we're eating. Um, One thing, I know this may sound harsh, especially culturally, because my family does it, is sharing spoons with parents and also like siblings. So a parent eats something, or they may blow on it or actually like lick it before giving it to a child. That is so sweet. But it also can be a little bit dangerous, especially if the parent or the person whose mouth, the adult mouth, that's touching that item going in the child's mouth contains bacteria from decay already existing. So now you're introducing a pretty sterile mouth to bacteria that it's never seen, especially bacteria that can cause decay. So I would recommend not doing that. Also, another thing is putting the child to bed with a bottle. I'm sure it is very soothing because the child is no longer crying. However, allowing for those substrates to sit all throughout the night, especially when it's a nice warm environment, that can also result in the breakdown of the enamel. And what we see oftentimes is what is historically known as baby bottle rot, or baby decay, tooth decay. That's what's happening during the night. So once a child falls asleep, I would suggest wiping the teeth off, again, with something like a terry cloth, or even using like a little toothette to get the milk off. And then if the child has to have something soothing to go to bed, it should just be water.
Thank you. And so far, we have one more question. This is our last question is, what daily habits can help prevent cavities and gum disease?
Daily habits: drink lots of water. And that's for everyone, not just kids, right? So drinking lots of water and not sipping on things that have sugar. Some of us may have children that are in sports, that 12, that tween age group, the kids that are really busy. Gatorade is probably not the greatest drink to have if you don't play a sport or if you're not actively replenishing electrolytes. So I would suggest not having those. And then when it comes to the snacking, um, children, it's okay to snack, but we should be mindful of the type of snacks and the frequency, because even children that have healthy diets, things such as the Mott's, like gummy candies, those things are so sticky. And if we're having them all the time, they're sticking to the teeth, and that's going to break things down. So the biggest thing, because there's only so much you can control, would be watching what we eat, the diet, and then doing our part to remove anything in our diet that can actively cause decay. And then staying on top of those oral visits, right? So coming to the dentist when you're supposed to. So every 6 months. And then if you have a child, or even again as an adult, you learn that you have a cavity, get it fixed as soon as possible. Because especially in the way that baby teeth are constructed, their anatomy, a tooth can go from being very small with a decay, or rather a cavity, let's say in 1 month, but in a 3 month time span, that decay can grow huge. And now we have a tooth that may need to be extracted when it could have been treated early on, let's say within the first few weeks of its diagnosis.
Thank you so much, Dr. Sterling. That was
Thank
great
you.
information and guidance that you provided. As y'all can see on the last slide with questions, Dr. Sterling has her contact information, just in case you would like to take down her contact to reach her. Miss Tiffany, could you please pull up my slide number 7?
Right before we proceed, Ms. Jasmine, we do have time to take this very last question that's in our chat, if you do not mind. And it
Oh,
reads,
okay.
do you think we could have legislation to give students time to brush their teeth after lunch or breakfast while at school to help prevent cavities and improve oral health outcomes?
That would be a brilliant idea. I think that would be an awesome way to get started. I am not familiar about how the school systems work, but I would suggest if you have a child in a elementary school, or even at daycares, I know some daycares definitely do it. I think that would be a great place to start, to see what your school can implement there. But definitely for those of us on the more integrated in when it comes to legislation in healthcare, it's definitely something that we could consider. Um, Hopefully, it doesn't interfere with what's going on with the back and forth regarding the fluoride epidemic. But still, brushing, whether it's with fluoride or not, would be a wonderful admin to our systems.
Thank you, Dr. Sterling.
Thank you.
Now for our closing remarks, Dr. Lawthall, the Bureau Director of Wellhead, Louisiana.
Well, I want to thank all of you, and in particular, Dr. Roberts, for your passion, your dedication, your expertise that you're bringing to promoting a comprehensive approach to improving oral health in Louisiana. Also want to acknowledge Jasmine Alexander, our Well Ahead Oral Health Manager, for her dedication and expertise, along with her direct colleague, Crystal Woods, and well as Tiffany Treadway, our comms division manager, for her dedication and expertise to improving health communication to improve Louisiana health status. I think as we've heard today, there are numerous things that we can all do to improve our oral health, and how important that is, but also how important it is to instill that right really almost at birth with an infant, and then create that environment in between the bond between parent and child, and be able to really ensure that we give our children adequate oral health care services, both things that we can do on our own at home, all of the efforts that we can make, as well as as well as seeking dental services. And I do want to reiterate that we should look carefully at what are the dental services available in the state. There are programs. Individuals may, in fact, be eligible for the Louisiana Child Health Insurance Program that does have oral health care in that, and that's for pregnant women, infants, and children. There are activities as well as that for other children. There are additional services, and for adults. So please, it's such an essential component of our health. And I just want to thank all of you today for joining us in this wellness webinar. And we hope you're leaving with valuable insights and practical tools to enhance your well-being. Remember that wellness is a journey. Small, consistent steps can lead to meaningful change. So stay mindful, prioritize self-care, and support one another in this journey. And we thank you. and looking forward to hearing from you. Please feel free to reach out, and we will make sure that this webinar gets posted as well. And we look forward to seeing you in future sessions. So back to you, Jasmine.
Yes, as Dr. Lothal stated, again, we thank you all for joining today's webinar, and a huge thank you to our speaker, Dr. Sterling Roberts. We are walking away today with more enlightened and empowered information to assist us in oral health care. That being said, to find out more about Well Ahead and our numerous programs and services, please visit www.wellaheadla.com or contact us at wellahead@la.gov or call 1-844-522-4323. And again, thank you all and have a blessed day and practice that self-care.